have you perform a couple of movements for me, Samantha. Can you bring your hands straight out in front of you? So just stretch your arms out at the shoulder. Do you feel any increased tension there?
Not as much.
Not as much. So you're going to feel a pinch up and out. Maybe just a little bit of a difference there. So I definitely feel that area of pressure here. So beginning with your ortho assessment, I do want to have a bit of a look kind of at the upper body as well as the upper extremities. Might have a little bit of look at the hips and the pelvic area, but I think most of our concern is kind of lying here, specifically at the shoulders. I know you said you had a little bit of tension, mostly work related, and we have kind of assessed that before. So I do want to just look at, do you see maybe just a little bit of distension here, some roundness at the top of the scapular region? Do you feel any pressure here? Are you feeling any warmth?
No, no warmth.
No warmth.
Maybe a little tightness.
Tightness? Okay, that makes sense. And is it particularly worse on one side or the other, or is it about the same?
No, it's about the same.
Okay. So usually if it's even and it's dispersed throughout the entirety of your upper back, that's a little bit better than if we have it on one side or the other, which could indicate like a muscle strain or tension in the ligaments. So it could just be that you have just some overall compression happening of the spine. So definitely want to have a look at the cervical spine, which is kind of up here just below the base of the neck. Okay. Now, do you notice that there's any difference in tension or pressure when you move your arms around or when you're bending at the waist?
I think like if I'm lifting something up, I tend to feel it like
Kind of up above?
up above.
Okay.
I feel it right here.
Right.
But not so much bending down.
Okay, so just come here centered. I just want to have a look for maybe very mild misalignment. I'm actually going to come behind you. So, is it okay if I just move your hair just slightly out of the way here? Oh yeah, so just definitely just a little bit misaligned here. So your right side, say we're about a quarter inch to half an inch difference there. Okay. Now, down at this thoracic spine, I don't see as much misplacement, and pelvic bone looks about in line there. Maybe some mild misalignment here. So I do want to do a bit of posture assessment. I'll have a better look at your spine. For now, I'm going to focus kind of here, upper body. So I'm going to start with just some palpation, feeling around. I want to get a sense for any inflammation. Now, if I just kind of feel here at the elbow coming up the ulnar towards scapular indentation, you're quite a bit warmer here at the upper back, which does just kind of indicate that there is a little bit of inflammation happening. So yeah, about a 3 to 4 degree difference there in the skin. Okay. So I'm going to do some measuring as well. So let me come back around the front to start. Okay. So coming back in, I have a tool here that's going to measure for that inflammatory response that I was talking about. So because I do feel a little bit of heat at the back of the shoulder, I'm going to check first up in the front. Okay. So I'm going to just use this tool. It is a little bit cold to the touch, so you're just going to feel this. I'm going to kind of move between gliding it across the skin and then just manipulating in different areas. There's nothing specific you need to do at this time, so just relax for me. I'm just going to touch this to your skin to start with, and if it does get a positive indication for excess inflammation. It will alert me with a mild vibration. So far I'm not feeling that. Definitely not down here at the lower arm. Just take your hand here if that's okay. Do you ever feel any of that tightness in your joints of your wrist or your fingers, or even down at the elbow?
Sometimes my elbow.
Sometimes elbow, okay. And is that inner or outer?
I can't tell the difference.
Okay, so I do get a little bit, you may feel that mild vibration there. It's not very strong, but I do feel a little bit of inflammation here. Not so much at the outer, okay. Then I'm just gonna check here right at that socket where your shoulder meets torso. Again, just a mild inflammatory response there as well. So far, no major indications, which is a good sign. So I'm just going to come across right below the clavicular line. So your collarbones kind of run parallel here, and I'm just going to test directly below. Just going to hold your jewelry for a second. So right at the chest wall, I am getting just a mild inflammatory positive indication there. And not so much on this left side. So again, I'll just test. Maybe a little bit warmer actually here on this side. Okay, so again, positive indication there, which is interesting. So do you tend to do a lot of lifting at your job?
Yeah.
You do. Okay. All right. So what I'm going to do is kind of alternate with testing of the front of torso, and then I'll have you rotate for me and I'll have a look at your back. So for now, let's kind of do some more front focus testing, and just going to take a couple of measurements here. So to start with, I want you to sit in a very relaxed, just kind of natural position, how you would sit maybe on the couch or in a chair. So don't try to, align perfectly, just sit comfortably for me. I'm going to turn your head midline here. Good. And I'm going to start with just here. So we will mark that at about 38 degrees, and then I will test for symmetry on this side, and actually slightly asymmetrical there by about 4 degrees. And I'm going to follow up and test. So going parallel to ulnar bone and then testing at the chest wall. So we do have a very good squared angle there. So that's right at about 91 degrees. So that is good. And if we line just on the other side here, again, check symmetry there. Okay. I'm going to follow that up here with, I'm just going to get a little bit closer to you here. I'm going to test, at the clavicle. So far, not seeing any particular signs of inflammation at the clavicular region. I do want to test for symmetry though, so I'm just going to get a gauge. Start just here. Very good. And then if we come kind of laterally here, we got again just a mild difference there. So I do think that you have just a little bit of distension on this side. So that's something that I will look at more when I assess your spine. But overall, I could have you just protrude your clavicle. So you're just going to kind of push up and in. Perfect. So I'm actually just going to palpate here manually. So I just want to feel briefly Sometimes if there's inflammation here, it can indicate more of a frontal issue, but I do think yours is more spinal related. No auditory differences there. Okay, you can go ahead and relax there. That looks good. All right, so why don't we do some tapping here. Now this is just more so testing for your natural reflexes of the bony prominence. So for example, you might have had your general practitioner kind of do the ulnar test there, and we saw a response at your wrist. Again, can test at the wrist, and all of that looks fine. Okay, so we'll do the same thing on this side. Maybe a milder response there. Okay. Good. Okay. So coming in with a few percussions, I'm going to be tapping around at the bony prominence. So you have areas where the bone is distended closer to the skin, and that's just where I'm going to be listening for anything that sounds particularly obtuse or affected negatively here. So I'm just going to move your hair a little bit. Just sound pretty even bilaterally there, which is good. All right, coming back in with that same tool we used before, checking for the inflammatory response. So I'm just going to start here at the back of the shoulder. So again, it's going to feel rather cold. Come up towards the shoulder. Some mild inflammation there. Okay, so already more of a response here at the back of the scapula. Indicating some slight inflammation there on that right side. Okay. So a little bit of a positive indication here on the left, but I wouldn't say it's quite as strong as on the right side. Okay. So I'm going to do some passive manipulation just to get a better sense of the overall posture and test some core strength here. So what I want to do is have you close your eyes. That's just going to allow me to have you relax more naturally. When our eyes are open, we tend to be more alert. So I want you to just close your eyes kind of lazily for me and just allow me to move you. So sit rather passively, and you're just going to feel some very mild movements, just kind of going a little bit at a time. I just want to get a sense for how rigid you're feeling, how tight things actually are. So just feeling around a little bit. Good. So I'm going to have you kind of squeeze in at the abdomen. Very good. Very, very good. Nice and tall there. And if I just kind of adjust here at that temporomandibular joint. So I'm going to take some measurements while I have you in this kind of active seated position here. So just measuring down. Right about there. have you perform a couple of movements for me, Samantha. Can you bring your hands straight out in front of you? So just stretch your arms out at the shoulder. Do you feel any increased tension there?
Not as much.
Not as much. And then bring your hands down at the side of your hip. Anything there?
No.
And are you able to reach your hands behind you at all?
Like,
Do you feel anything there?
no.
Good. Okay. So that's a good sign. So again, like you said, with that overhead lifting is where you're feeling most, which tells me that it's kind of isolated right here at this shoulder socket. So I'm just going to do some palpation here. You're going to feel me kind of in between the musculature here. So I feel just a little bit of mild distension here. So you said you were feeling tension on both sides, and while I do feel the inflammation kind of parallel here, it is bilaterally distended, but I definitely do feel more on this side. So I think what I'm going to do now, Samantha, is have you actually turn around on the table for me. I do want to have a better look at your spine, so I will allow you to flip around and get comfortable, and then we can proceed. Okay. So coming in with my pen light, I'm just going to have a look at the spine and looking at the overall kind of structural integrity. I want to see if there's any protrusions or any signs of inflammation that I see. As I palpate here, does that cause you any discomfort?
No.
No. Okay. I am just going to feel again here for some temperature variation. You are quite warm at the top of the shoulder. Okay. Just going to go back in with some percussion here. I just want to listen. So some variation here. Some mild distension there. It's going to feel a very cold sensation. It's that same. So definitely getting a bit of a positive indication there. More so on the right side again. And if I come just kind of directly over, a little bit of a jolt there, and then not so much coming down. So it does seem to be isolated more so to that top, which makes sense because you said that's where you were feeling majority of the tension. I'm gonna do some bone conduction here, so just gonna use this. Maybe just a little bit of a difference there. So not hearing too much of a difference there. Just a little bit of very brief muscle activation. I have it on the lowest setting, so you may not even feel anything. If you do, you'll just feel kind of a slight twitch in the muscle, and that's just going to allow for a rapid activation and then loosening. And then I will do some treatment to roll out any of that excess inflammation. I just want to go above and below the scapular indentation. So kind of right at the wing of the scapula there. And then actually if I can have you kind of externalize that just a little bit, very good. It might feel just a little bit deeper here. Shouldn't cause you any pain, it kind of just feels like a bit of a twitch. So I do see just some mild distension here. So I'm actually going to split your hair in half here. Any pain or pressure here? So you have one little knot that I see. It's not particularly large, but it is noticeable. So about 1.5 inches. Probably about 3/4 inch there. Just measure that here as well. Yeah, so right at about 1.5 inches. And about 3/4 inch wide. So remember just to document that. So this is going to feel rather cold. I'm just going to go in with a bit of decompression. So where I just activated those muscles, they're nice and tender, ready for therapy. So I'm not doing a very hard pressure here. Definitely let me know if this is too much or if it hurts. Some people are very sensitive to rolling of the joints and any musculature, so I also realize it's rather cold. It will warm up the more that it comes in contact with your body heat. So I definitely feel that area of pressure here. So I'm just pulling kind of taut upward on the skin as I roll downward. Then we're going to go out and away from the spine. Just going to apply some direct pressure here. Fairly even symmetrically. Have you try to pinch this right at the middle of your spine? So just kind of visualize pinching directly at the spine there. Does that cause you any excess tension, pain, or pressure? Good.
No.
And that's about even there. Very good. Okay, you can go ahead and relax there. Put a pair of gloves on simply because this is going to allow me just a little bit better grip. I'm going to do some very mild tugging of the skin. Okay. Alright, so I'm just going to feel for areas of pressure here, and we're going to do some mild testing of skin trigger for 1. So just gentle pinching motion. Good. do some inflammation relief. So you're going to feel a pinch up and out. And it just allows for fluid release directly underneath that adipose tissue. So again, up and out. And up and out. Here, just below, up and out. Good. It's just a little bit more tension on one side versus the other, which is interesting. Okay, so a little bit here, so I'm just going to hold there. Not as much here, which is interesting because this is where I feel majority of the pressure. So it could just be inflammatory response that's overcompensating for the lack of strength on this side. Test laterally, I don't notice it nearly as much. Okay. As I come down towards the hip bone, again, looking at symmetry, looking for any signs of asymmetry mainly, looking for any wasting. Not particularly notable here. Just going to have you sit up very tall for me. Very good. Nice and symmetric there. I don't notice any maybe some mild distension here, but that does look okay. Certainly better after a bit of that decompression. Okay, you can go ahead and sit relaxed. So I'm going to have you just turn back around for me, Samantha. We can kind of discuss what I think is going on. I want to have one last look over at the neck area, and then we should be good to go for today's appointment. Okay? All right, so essentially what I found is that you do have some bilateral tension, meaning you have tension kind of running along both sides of the upper back. A little bit of the mid to lower back, you have about a 1.5 to 3/4 inch, we'll say protrusion. It just looks a little spot of inflammation. So I did a little bit of rolling here with the Jade roller. Now this is something that you could do at home. They have some that are kind of extended that you could do some rolling on yourself. A little bit of tension relieving therapy there. The biggest thing I would say that I noticed is that you have quite a bit of a temperature variation. So between your kind of hands and upper extremities, there's a bit more of a coldness. Could be a lack of circulation, but it could also be that there's just extra tension and warmth here, which I'm thinking is kind of the problem. So you do have quite a bit of warmth in kind of the upper thoracic region, a little bit of inflammation, definitely more so on the right side. Okay. In the meantime, as you said, when you do kind of the overhead lifting, you are feeling more of that pressure. So as much as you can, try to avoid it. I realize that it's work related, so maybe not so much, but when you can rest it, we can do an alternating ice and heat until we can get you back in for some more therapy.
Okay, sounds good.
All right. So I am going to go ahead and document all of that for you. You can access all of that in your portal. I'll try to get you back in the next 3 to 4 weeks if you have availability.
Sounds good.
Okay. All right. Did you have any questions for me?
No, not today.
Okay. All right. So I will go ahead and take care of that, and in the meantime, I hope you get home safely.